SB 363 will require data for reporting assaults by inmates or patients on staff at facilities run by the Department of State Hospitals, California Department of Corrections and Rehabilitation, and Department of Developmental Services. There are documented incidents of violence that provide the foundation for workplace violence prevention. However, the aggregated data regarding assaults of state employees in our most challenging and violent state work sites is unfortunately not readily available. In order to increase and ensure safety for our employees at these facilities, we need a comprehensive assessment of where violent incidents are happening, how often, and to which employees. The stakeholders in states should be able to provide data reports on a monthly and annual basis, respectively, to monitor the occurrence of violent incidents involving state employees. And this data would include the number of occurrences for each facility, job classification of employees assaulted by a patient or inmate, and the date of the assault. By ensuring that the legislature and the respective chairs of the budget committees receive these reports annually, this legislation takes a logical step in mitigating staff assaults in our state facilities by utilizing the legislature's oversight to collect data that could be used to explore future policies or regulations that promote a safer environment for both staff, patients, or inmates. I am offering amendments to address policy comments raised in the analysis. These amendments do the following. 1, require the 3 departments to make the reports to the bargaining units rather than the individual facilities that make the reports. We are changing 2, change the term violent incident to assault, and cross-reference to the definition of that term in existing law, and 3, add a definition of facilities for purposes of the bill to provide clarity. And I have here today with me Abdul Johnson, a chaplain at Valley State Prison and Coalinga State Hospital, and Dr. Haley Williams, a forensic psychologist at the California State Prison, who are here to share their experiences and to answer any questions. Thank you so very much.
Senator Pan, the vice chair is in support of your bill. I think there's unanimous support probably here. So with that, I'm asking if you keep your comments brief. We really appreciate you being here.
It's red light on.
Okay. Good evening. Hi, my name is Haley Williams. I am a staff psychologist at CSP Sacramento. I'm here as a member of AFSCME Local 2620. This bill is very important to me. Staff safety is very important to me, as I think it is everyone who works in this department. Staff is assaulted daily. I mean, it's an alarming rate within the system. We are assaulted physically, verbally, sexually, sometimes multiple times a day to the same person. And unfortunately, there's not a great way to track that. I really appreciate all of the work that's been done on this bill from the authors, because it will provide a way to track these statistics, and that is really vital. By tracking these statistics, as we know, history does have a chance of repeating itself, and by tracking these appropriately, not only can we see these numbers, but it will also hopefully help people prevent these from happening again and again, because as of right now, this information is not readily available. It's important to me for several reasons, but mainly because I see this happening all the time. It's happened to me. I want to briefly share one of my experiences. Real brief?
Keep it brief.
Okay, about a year ago, I was gassed. That's a term that we use for people who are, have substances thrown on them. As I walked into a room, I had a full cup of urine thrown in my face, in my eyes, and my mouth. This was before I could even get one word out to this inmate who has a very violent history, a violent record. And this is something that happens often to staff, and then we are expected to resume our normal duties and go back to work the next day as if nothing happened. And I think it is important to track these statistics for everybody. It's not nice for this to happen. It's not pleasant for this to happen. And I'm hoping that something like this can prevent this from happening in the future to other people.
Thank you for your testimony. We're sorry for the experiences that you've had to share with us.
Abdul Johnson, President of AFSCME Local 2620. Thank you, Chair and members of the committee. I will, out of respect, keep my comments brief. I do want to bring attention to the assault that kind of was the nexus for this bill. It was a 73-year-old social worker who was raped and assaulted at her desk at California Medical Facility. It's important that we have this data because it goes, the fact that this is the first time you all are hearing about it is a concern for us. So as we move forward, we respectfully ask for a yes vote on SB 363. Thank you.
Thank you for your testimony.
Mr. Chair, Vice Chair, and members, Brian Olson on behalf of the American Federation of State, County, Municipal Employees. Proud to be a co-sponsor of this very important legislation. Also won't belabor the point. I just want to highlight the excellent work done by the committee consultant and in working with us to ensure that the language is appropriate, and will respectfully request an aye vote in the interest of transparency, accountability, and oversight.
Thank you for your testimony. Any questions, members? Is there a motion? Senator Leyva. And we have to first hear from those who also support the bill. We can still have a motion. That's cool.
Thank you, Vice Chair. Adrian Mohammed with the Union of American Physicians and Dentists. We represent the doctors at CDCR, DSH, and DDS, and we are in strong support of this
Thanks for your
legislation.
service.
Lydia Bourne, American Academy of Pediatrics, in support.
Thank you for being here.
My name is Heidi Tuttle, and I'm a psychiatric technician. I was assaulted and a victim. I was stabbed several times. It hasn't been a year yet, and I almost lost my life.
Thank you for your courage in being here. We really appreciate it.
And I'm in support for the bill.
Thank you. Thanks for your testimony.
Marianne Padilla, California Association of Psychiatric Technicians, Bargaining Unit 18, and I support this bill.
Thank you.
Ilk Choi, psychologist at Department of State Hospitals, Patton. I have 2 points to make. One, we at the state hospitals work with the most dangerous patient population across hospitals and health facilities in this nation. Outside our gates, our patients are transported in handcuffs and leg and body shackles, but inside the hospital, we work with them with no barriers and with just personal alarm for our safety. And you've heard some personal testimonies of our staff who have been personally assaulted. I have 2 other statements from a psychologist and another psychiatric technician. I won't go into them. My second point is I also represent the Safety Coalition of Bargaining Units at Patton State Hospital. It's a coalition of all the different bargaining units at representing employees at the hospital. We've been trying to get this kind of data from management about assaults against staff, and we've not been very successful in getting this information.
Thank you.
We do get some injury and illness information, but not assault information. Thank you very much.
Thank you very much for your testimony. And I'll call up anyone opposed to SB 363. Anyone opposed? Seeing none, Dr. Pan, if you'd like to close, we have a motion by Senator Leyva.
Yeah, thank you. I do want to thank all the witnesses who took time to travel here, and I apologize, but we do have tremendous support on the committee, which I hope will be expressed quickly in this vote. So thank you very much, and respectfully ask when I vote.
Okay, and this is due pass amended to Labor, Public Employment, and Retirement. Will you please call the roll?
Pan?
Aye.
Pan, aye. Stone?
Aye.
Stone, aye. Durazo? Aye. Durazo, aye. Grove? Hurtado? Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Monning? Aye. Monning, aye. Rubio? Rubio, aye.
That's out with 7-0. We'll hold it open.
Hold open.
Senator Pan?
Thank you so very much. Thank you.